Can we just quickly touch upon the guilt and shame of this kind of a patient context? Is it coming on the women's side, husband's side, or is the situation changing?
Again, let me speak for the man first. So the man is a shy animal, honestly, and he would not go and consult a doctor itself. So he's the worst. He feels shy to even face the doctor. And which is why, unfortunately, andrology, that is the male aspect of infertility, has not developed that well. Because men are not good patients. They will simply avoid. And there's something called ICSI, that is intracytoplasmic
Yes.
sperm injection, where even if you have one or two functioning sperms, we can achieve a pregnancy by using that sperm to fertilize an egg. So ever since ICSI was discovered or invented 30 odd years back,
Can you educate the audience a little bit about ICSI?
so what happens in an ICSI is, so in a general semen sample, you would require something like 30-40 million sperms, and let's say half of which are motile, healthy looking sperms. But in case the sperm count is much lower than this, even then an ICSI can give you a pregnancy where we take one or two healthy sperms. One sperm is then injected into one egg, which has been retrieved from the female ovaries through the process of IVF or ovum pickup. And that one sperm being injected to one egg will form an embryo, and there's a high chance that that embryo will then give us a pregnancy. So men with worst of semen samples can also father a child through a IVF process or assisted reproductive techniques. So once IVF has become the mainstay for treatment for men, unfortunately, them seeking help for treatment for improvement of their sperm quality has gone down even further. Because we all know the solution for that is basically go for an IVF or an ICSI, and this will work out good for you. But there's no denying that lifestyle management is the best option if we could ever implement this for men. For women, yes, they are always suffering from guilt or shame, and that's mostly brought on to them by the family and the friends. So somehow we have this culture in our country where the women are looked at or upon as being responsible for bearing children. And we have this magic number: you married for 2 years and you don't have a child, so you'll have unsolicited opinion, advice coming from everyone. And that's the biggest pain point. In fact, when people undergo IVF with us, they keep saying the same thing: doesn't really matter if the cycle fails, but I don't know what I will answer to my mother-in-law, sister, whoever it is in their family who is the decision maker. So this is something that needs to be understood. Reproductive rights or choices are a person's individual preferences, and we need to respect that. We need to respect that. Women do seek help nowadays, and I see this as urban India. They're actually very open about coming and discussing about their problems. But half of the conversation that we do with them is also to do with the fact that they are suffering from guilt or shame at not being able to give a child or give a heir to the family as being pointed out by their family members. This is something that is going to change, is changing, and I'm sure will change.
And how important is a psychological support in this whole process?
Okay, yeah. So, see, at NOVA, we understood this long back that it's a journey. And when it's a journey, they need somebody to kind of partner them during that journey. It's not a quick fix solution. You don't have a 5 days antibiotic program, you take that and you get pregnant. And in some cases, you would start with a natural method of getting pregnant. If it doesn't work, then you move on to an IVF. In some other cases, you would start with an IVF. Maybe the first cycle doesn't work and you have to go for the second cycle. Most couples would require to be patient in their journey. And in any journey, you would have highs and lows. So you need somebody to hold hands with you. We have counselors who have our qualified psychologists, basically, who have training to do this, who've understood the whole aspect of fertility, the pluses and the minuses of fertility treatment. And they're always there to hold hands with both the male and the female partner. Essentially, what they do is connect with them on a regular basis, keep them apprised of what's going to happen next, and also tell them the outcomes of the cycle, the treatments that have happened, empathetic to them. I would not say sympathetic, empathetic to them.
Yeah.
So that's what they need. And obviously, judgment-free listening. So they just listen to the clients, understand their concerns, and they relay them to us. I would say our journey is made much more comfortable with the help of these counselors. And this is a unique feature that we have in IVF.
So, many patients are obviously, understandably, they're stressed out of the whole process.
Absolutely.
And as far as we know, stress increases the cortisol levels. The sympathetic stimulation, how does it affect the outcome?
See, of course, the whole fertility journey or treatment for fertility is highly stressful. I wouldn't say that you can avoid stress. You need to manage stress. There is the financial angle. People have, and these are young couples.
Yeah.
So, in most circumstances, it's self funded. Unfortunately, in our country, there's no company funding or insurance funding that you have for these treatments. So, you have to fund for the treatment. And then there's the stress of the success happening or not happening. And then there's a third stress of managing your job, your work responsibilities with the treatment. So, and there are intercouple stress events also. So, it's my problem versus your problem and how to handle these problems. So, we realize that there's a stress. We also understand that stress needs to be managed. But to really say that stress affects the outcomes is, I would say it's stretching things. Because as such, stress does not lead to any direct impact on outcomes. It does make them take wrong decisions, hasty decisions. It clouds their vision. It makes them very panicky. They need to be handled with care, if I would say so. We need to be always present for their concerns. But by and large, stress is something that has to be managed. And here also, I'll bring in the counselors. They do such a wonderful job. They're always there. They're the listening ears. They listen to them. They talk to them. And whenever somebody is feeling stressed out, they have special sessions for them. What we've also tried to do in NOAA, and I'm sure that others are also doing it, is to bring certain couples together, people on a similar journey, and try and put them together with somebody who's gotten pregnant and given birth maybe. So maybe they learn from that person, talk to her. When there is a peer group going, people open up a lot more. They discuss their individual issues a lot better and more clearly. And that is also one way of stress management. Eventually, I would say this is a learning process for each and every couple. And over time, then learn to manage their own stress in their own way.
That's wonderfully put. And I cannot even imagine what people are going through. And especially after like one or two failed IVF cycles, the stress management is really important.
Absolutely.